Welcome to today's episode of Talk Show. My name is Lucy Wansakariuki and I'm your host. Today we are going to discuss about a condition which has become a big burden in our country and around the globe. We did it some time back, but today we are taking it a higher note. We have a beautiful guest in the house who is going to introduce himself and will be taking us through the show. Welcome to the show, Daktari.
Thank you, Lucy, for having me in this show. Pleasure is all mine.
Yes.
And the topic that I'm talking today is a big concern to the public, to the country large, because it has a very big impact, both emotionally, financially, in all aspects. Let me start by saying this thing, I can compare cancer right now, the situation we are in right now, with the HIV/AIDS.
Yes.
Not like per se the same, but almost like, because in HIV we used to say it's either you are infected or you are affected.
Yeah.
So either you know somebody who has it or you have the cancer. So like for me on my also part, I can say I lost my wife due to cancer.
Sorry.
This month, we just buried her this Saturday. She had cancer of the breast, stage 4, mets to the spine, and also cancer of the ovary. So it's a good topic, and I'd be glad to share and model information on it.
Yes.
About cancer to the public and to our viewers.
Yes. Kindly tell us your name.
Sorry about that. My name's Ben Bella Onyino. I work in Kenyatta National Hospital in cancer department.
Thank you so much and welcome to the show, Ben.
Thank you.
We had you some time back and we are happy to have you again. Cancer is a burden to this country. Many people do not know really what is cancer. In fact, yesterday I was in a sensitization meeting, and the biggest worry that my heart went home with is when women were running away, fearing that they could be having cancer. It was just sensitization meeting. We just wanted to talk about cancer, but they were fearing. What is the burden of cancer, Ben?
Thank you so much, Lucy, for that very nice question. The burden of cancer is so huge. Let's start from the family to the society, even to the country at large.
Yes.
If we start with the family, we start from the stigma about cancer. When most people are told about cancer, the immediate thing that runs to their mind is death sentence.
Yes.
So there's that psychological part of it. Then still on the family, the burden is the financial, the cost of treatment of this disease.
Yes.
Is so high, both in the country and also outside the country.
Yes.
Then also when you come to the emotional part of it, because as a human being, you have so many domains which normally control us.
Yeah.
So you find the burden will be both the physical, the spiritual, and as I've said before, also the financial part. To the family, to the society, you find a person will not be productive. If you have a worker working in your organization or in your society, then he or she is diagnosed with cancer. The treatment of this disease, you find it is a chronic illness.
Yes.
So the treatment will be a long time. By the word chronic, it means the treatment will take a long duration to treat.
Yes.
So this person will be in hospital in and out after every 2 weeks, 3 weeks, going for appointment to receive the chemotherapy or the radiotherapy. So in the society, this person will not be that productive because he or she has to go and respond to or to go and be treated in the facility that they normally receive their treatment. In the country, if you have a society whereby most of the productive people, because right now cancer is affecting both the very young. We used to say in the old days,
yes,
it's a disease of the old people. But right now, you can even see very young people getting cancer.
Yes.
So you find that productive age, they're in hospital, being treated for cancer. So this burden, it cuts across right from the family to the national level.
To the national level.
Yeah.
And you've talked of financial implication, the burden of finance. Right now, the country is undergoing a lot of economic destabilization because of the rise in fuels. Can we say that is also affecting cancer? Can it be a burden when it comes to financial implication? Or now that the fuels have gone up, it is only the matatu drivers and the people with personal vehicles who are going to feel it? In relation to cancer, how can you be able to talk about it?
Thank you, Lucy. That's also a very good question.
Yes.
In relation to cancer, I can put it like, you see, my patients, let me talk about my patients,
Yes,
the one that I normally
your
attend to.
patients.
They travel from very far to come and seek these services, maybe in the country, in Kenyatta National Hospital or any facility, because due to very few cancer centers across the country. So the cost of traveling will be very high on my patients.
Yes.
Then another thing, since the cost of fuel has gone up, also the food prices have also gone up. And most of these patients, when you are talking to them, when you start the treatment, we talk about nutrition.
Yes.
Because the treatment, it also has some side effects. The nausea, the vomiting, those side effects.
Yes.
So when you talk about food, and the cost of food is high, and the next appointment, I expect this patient to come in a good or fit nutrition status.
Yes.
Yet they cannot afford to buy that food. So at the end of the day, at the cost of treatment, I will tend to lose this patient because the nutrition-wise, they're not performing very well because they cannot afford to buy food. And I expect them to come for the next cycle when they are fit.
Yes.
So on the cost of living, the fuel, everything is skyrocketing, it will affect because they can't afford to buy food, because we are living in a country whereby the cost of the cost of living per day, they say it's $1 per day. We have guys living in less than $1 per day. So buying food, it will be also difficult to these patients. So it will affect, yes, because at long run, they'll not be able to buy food and be able to maintain that good nutrition status for the next cycle of treatment. On the side of transport, the skyrocketing, and remember I've mentioned before, it's affecting also, they're not able to work.
Yes.
So meaning most of these people, they're not able to go to their daily activities to earn their daily living. So they can't travel because they can't work. They can't travel. The cost of transport because of fuel is high. They can't also still travel. So you expect them not to adhere to the treatment.
Yes.
So it will also affect.
This means our government has a lot to help its citizens, because apart from food prices, then everything else is going up. Because I'm sure even in your cancer center, you have machines which need a lot when it comes to that. Today we are talking about liquid cancer. What is this we call liquid cancer?
Thank you, Lucy. Liquid cancer, in cancer we talk about two types.
Yes.
You have the solid and the liquid.
Yes.
The solid, as the word says, solid, is something you can feel, is a mass.
It's a mass.
Yeah. So we're now coming to categorization of cancers. So now in liquid cancers, this is whereby we talk about the blood cancers, like the leukemia, of which you have the acute and the chronic, the subtypes. But in general, we have the leukemias. Then also we find in the liquid, we also have the lymphomas. Type of cancer. They also fall under this type. But in short, in liquid cancer, these are cancers which normally affects the blood or the bone marrow.
Okay.
And the solid, they're the ones which affects the organs of the body.
Yes. Okay, when we talk of leukemias, which means there are several. I've heard people saying that I have leukemia. So when you talk of leukemia, what do you mean? And what are these types?
Okay, the word leukemia is a Greek word. It means white blood cells.
White blood cells.
So when you talk about leukemia, this is a cancer which affects the white blood cells. And the word cancer It simply means abnormal or rapid multiplication of cells. So in this scenario, there's an abnormal and immature white blood cells in this patient, which are multiplying at a very fast rate, and they're abnormal. And most of them, they are also immature, and they're circulating in the body. And as you know, the white blood cells, these are the cells which are in our body. They're used for body immunity purpose, to protect the body against bacteria, viruses. But in this case, they have become abnormal.
In my primary school education, our teacher in class 5 used to call them the soldiers of the body.
Yeah, the soldiers
The
of the body.
soldiers of the body.
Yes.
They fight.
Yes, they fight the pathogens, the bacteria, the viruses, the fungus in their bodies. So in leukemia, these cells now, they become abnormal.
I want to get something, Ben, for the sake of the viewer. We've said that the white blood cells are their function, as you said, they fight. They help us to be healthy. Because if an enemy comes, we'll find that somebody's there to fight. And now you're saying cancer is when they start multiplying abnormally. There are many in number. If there are many in number, Ben, are we not saying that my body is more safe than yesterday? I'm just imagining if we have so many soldiers around here, are we not more safe? Why is it a problem now that there are many?
Thank you. That's a very good question. Because at the end, if you have more soldiers, you'll talk about defending your country so well.
Yes.
But you see now in the body, in these white blood cells, in the process of becoming so many and they're abnormal, they're not able to do the functions.
So the word was, there are many,
yes,
which means they do not have time to mature well. They do not have time to be healthy.
Yes.
They are weak. Yeah. So there are many but cannot help.
They can't help.
We have so many kindergarten soldiers.
Yes, you can use that word as a lay person or in a simplicity manner. Yes.
There are many.
So they can't do that function as the healthy ones can do.
Yes.
Yeah.
But it doesn't mean that they have replaced everything.
Yes.
Do we have some which are still healthy in that someone who has leukemias? Are there some cells which are not affected, or all of them now become sick?
In leukemia, the white blood cells are the most affected.
Yes.
The others, they are normal, but now in the process, also these white blood cells, they tend to overcrowd them. So the production is so high that the normal cells, like the white blood, the red blood cells, the platelets, they are so minimal because the white blood cells will outnumber them. That's why you find in most situations, they normally present with signs of anemia. Or maybe they normally also present, patients with leukemia, they also present with a condition whereby the blood clotting factor is affected because the platelets has been affected by the white blood cells, which have overcrowded them.
So apart from what you've just said, what are other signs and symptoms that maybe when you have worked in cancer center for some time, and I'm sure there are some of the complaints, things that you see, or signs and symptoms to show that this is leukemias, this is blood cancer, this is liquid cancer, and not any other cancer?
Thank you. That's a good question, Lucy. So most time you find this patient, they'll present with, I've mentioned about anemia.
Yes.
Anemia, this is a condition whereby the red blood cells are very low, or the hemoglobin level. The word we normally use is hemoglobin level is very low, below 10. It's because of the overproduction of the white blood cells, and the red blood cells, there are very few in the body. So the capacity to carry the oxygen, because the work of the red blood cells is to carry oxygen into the whole body. So they'll present with fatigue, easy fatigue. For example, if maybe is a student, maybe just some little exercise in the school, they'll make them to be exhausted.
Yes.
Or maybe just maybe climbing stairs, they also feel exhausted. They also present with palpitation. Palpitation is whereby somebody will hear their heart beating. They'll tell you that they are hearing, their heart is beating. So also they present with, they also present with, if you look at the eyes, there is what we call the pallor or whiteness of the eyes.
Yes.
Of the hands, the fingers. These are some of the signs. Or some will present with organomegaly. For example, they'll tell you if there's a mass in my stomach. When you do further investigations, you'll find the liver is enlarged and also the spleen is enlarged. So these are some of the signs, besides so many which they normally present with.
Yes. So what do you do to diagnose, to know that this is leukemia? What are some of the things you do? You've already talked about the signs and symptoms, which will lead you to the next level of investigation so that you can be able to know that this is liquid cancer.
Thank you, Lucy. Now, about investigations, when a patient presents to a clinician with these signs, after ruling out maybe the basic, depending on how they present, after ruling out maybe conditions like malaria, it's negative, there's no malaria, there's no typhoid, you can take the blood can be taken for, we normally call peripheral blood.
Yes.
For investigations, whereby you're able to examine in the lab, and you'll find there'll be very high number of white blood cells in that film.
Yes.
That is still not a confirmatory diagnosis that this is leukemia.
But it is leading us somewhere.
Yes, it is leading you to
yes.
to begin to query that I'm dealing with a case of leukemia. Now, the next thing and the most confirmatory investigation is a bone marrow, whereby the doctor will take a sample from the bone marrow in the sternum or at the hip, whereby they'll drill using a needle, a very strong needle, get some sample, then take to the laboratory for analysis. This is now the confirmatory test that this patient has leukemia.
Yes. Thank you so much, Ben. We are now going for a short break, but when we come back, you will be telling us what will be seen in that bone marrow, because you've said it is a bone marrow which will be injected with a needle, but you're going to tell us what is that the doctor has seen in the laboratory to tell us that this is liquid cancer. Viewer, we are going for a short break. See you then. Viewer, we are here discussing about liquid cancer. Cancer is not a respecter of age, it's not a respecter of race, it's not a respecter of the profession that we are in. Our guest has just confirmed that he has, even where he works, healthcare workers who are on treatment who have succumbed. So it's better if we get screened early. And when we do that, we are going to prevent more than enough. And we, as teaching time saves 9, and it's better we prevent than to go for this treatment. And when we are here, we can be able to understand that these things are not stories. We are not giving stories. These are realities of life. Daktari, in the cancer center, at what point do you get referrals? And at what point do you advise a healthcare worker from the periphery, from the level 2, level 3, to refer patients to you? Do you ever refer? You are the national referral hospital. If we don't get help in Kenyatta, where else can you refer your patients to?
Thank you, Lucy, for that good question.
Yes.
Let me start with the healthcare workers right down in the village.
Yeah.
If a healthcare worker, if maybe, let me use an example of a patient being managed for ulcers. You've been managing this patient for ulcers for quite a long time. Patient comes, you give omeprazole, goes back home, begin to think about, could I be dealing with cancer here? Take it further, do further investigations, do an endoscopy, and examine the lining of the stomach.
Yes.
If a patient comes with pervaginal bleeding that has been there for the longest time, as a healthcare worker right down in the village,
Mm.
don't just continue to manage those symptoms. Begin to think, could I be dealing with? Because cancer resembles like any other disease.
Yes.
It just present like ulcers, just present like abnormal vaginal bleeding, or an ulcer or a wound which doesn't heal. So when a healthcare worker, you are managing a patient in the village, and they're not responding to this treatment for a long time,
Yeah.
don't keep that patient down there. Refer to the next level for further investigations.
Yes.
So that we can detect this cancer at a very early stage. Because the more you stay with this patient, the more it's spreading. So when it comes to referral, most of the patients who come to Kenyatta National Hospital, they're in stage 4, unfortunately. Because they have been down there being managed, or they're in the house managing themselves, or thinking this is a curse or this is witchcraft. So by the time they come to KNH, already they're in stage 4.
Yeah.
In stage 4, it means this cancer has moved from point A to point B. If this cancer started in the breast, when this patient comes, already it has gone to the lungs, or to the brain, or the spinal cord. Already it has gone to other body organs.
Yeah.
So most referrals, they come to Kenyatta, they're in stage 4. And in Kenyatta, we don't refer patient to any other facilities. we manage them there because you are the referral. So we have we have all the treatment modalities in Kenyatta National Hospital to handle these cancer cases available in this country.
But we've had people going to India or other countries for cancer treatment. You're not the one who refers? We thought they are referred by Kenyatta, but anyway, maybe you shall answer that one.
We are not there. When it comes to treatment for cancer or any treatment, there's also the patient preference.
Choice.
Yes.
I want to go to India.
Yes. If a patient chooses to go to India,
you don't deny.
You cannot deny them.
Yeah.
Because it's their
right.
right.
Not because Kenyatta cannot handle.
Yes.
Okay.
I think the only condition that is not available in Kenyatta is bone marrow transplant or stem cell transplant.
Okay.
Hematopoietic stem cell transplant.
Yes.
Those are the cases that we normally refer to India or America or South Africa. But the rest, we have them here locally. If you talk about the investigation, the PET scans, we have them here in the country.
Yeah. Thank you so much. Missed diagnosis or misdiagnosis. Does it happen with liquid cancer? Misdiagnosis or a missed diagnosis?
Wow. Misdiagnosis in cancer, it's almost close to impossible.
Yes.
Because as per what I know, with how with the diagnosis, how it's made, once the sample has been taken to the lab, it has to be confirmed by more than 3 pathologists.
Okay.
So
not one.
Not one.
Yes.
Close to 2. Like I'm talking about Kenyatta National Hospital.
Yeah.
3 pathologists will have to confirm. So 3 people, it's hard for them to be wrong.
Yes.
Almost close to impossible. You can still find, but it's very rare.
Yes.
Yeah. Because when it comes to cancer, you have to be 100% sure that this is cancer I'm dealing with. Not just like any other condition that you say from the presenting signs and symptoms, this is cancer, start on treatment. No. With cancer, you have to be certain, almost 100% certain that I'm dealing with cancer. Then you have to take the patient through the counseling, the treatment, also counseling. Also, they have to sign the consent for the treatment they are going to start with. Yeah, so it's close to impossible misdiagnosis in cancer.
And so misdiagnosis and misdiagnosis go together.
Yeah.
It's very rare.
Yeah.
Because it is not a one-man thing.
Yes.
It has to be confirmed by several people.
Sure.
I know many people do not know where else, apart from Kenyatta National Hospital, do we have these cancer centers elsewhere, private or even our government hospitals?
That's a good question, Lucy.
Yeah.
Yeah, we have so many.
So that we all do not rush to Kenyatta for cancer treatment.
That's a very good question, because you find patients that they used to, back yesteryears, like 6 years ago, 7 years ago, they all used to travel to Nairobi.
Yes.
But right now you have cancer centers in Eldoret, you have cancer centers in Mombasa, in Isiolo. They are spread all over.
Machakos.
Yes, in Machakos, all over the country you have cancer centers, private and government-run institutions. So soon I know there's a body called National Cancer Institute that's going to gazette all the cancer centers we have in the country.
In the country.
So soon they're going to be gazetted. So somebody will be able just to go through the Kenya Gazette and be able to know in this county how many cancer centers are available, in this county how many there are, so that you avoid the traveling. Because the traveling also is so tedious to our patients. You can imagine somebody traveling from Turkana to Nairobi. Yet maybe there's a cancer center just close to them in Eldoret
they don't know.
or in Kitale, but they don't know. But once they have been gazetted, somebody's able just to know. There's one just next door here.
Wow, thank you so much, Ben, for being with us in this show. I'm sure you have something to tell your viewer. Maybe you do it. Again, remind us your name and where we can find you as you give your parting shot.
Thank you so much, Lucy, for having me in this show. It was very nice and very interactive to talk to the public. Even though cancer is a very big topic, vast topic, it can take weeks when you talk about cancer, or even months. Because if I talk about cancer, there are more than 200 types of cancers. And I can tell you for free, for sure, I think I haven't even seen more than 100 of them. There are so many types of cancers. But to my viewers, go for screenings of these cancer cases. Those cancers which are normally screened, cervical cancer, breast cancers, go for screening so that you can detect it at a very early stage. And when you detect it at a very early stage, the cure rate is over 90% curable. Then there's a lot about cancer. You can find me in Kenyatta National Hospital in cancer department. You can come in and walk in there. You can talk a lot more. Then still you can contact Lucy for more information. You can one-on-one talk, counseling or advice. Thank you so much for having me.
Thank you so much, Ben. It was a pleasure having you in the show. This is GPS TV Africa. I was your host, Lucy Wansa-Kariuki. Cancer is not a respecter of anyone. Kindly be screened. Bye-bye.